How would you feel and how would it impact your life if the government paid your Medicare Part B premium for you, the $202.90 that they take out of your Social Security check every month? If you didn't have to pay that anymore, would it change your life? If that would help you, and you're married, your income is around $40,000 or less, you're single, it's around $30,000 or less, I think you should watch this video and stay to the end because I got a special tip there. All right, my mission today is to explain to you how the Medicare Savings Program works, the MSP. Why? Because it could be a life changer for you. Travis and I have helped over 100 people probably in the last 2 years qualify for this program since it expanded. In New York, your income married can be almost $40,000 a year, and you can still get this program. Single, it's I think over $30,000. I'm going to give you the figures. But what will it do? It will reimburse you for the Part B premium they take out of your Social Security check every month. That's $202.90. Not only that, they may reimburse you for the previous 3 months that you have already paid after you apply. That's about $2,400 a year per person. It will save you potentially if you're on the program, if you qualify. It'll also give you a program called Extra Help, which is synonymous with low-income subsidy. And if you have any co-pays for medications that are high, it will drop those, I think, to a maximum of $15. This is a game changer, and there's so many people who qualify for it that aren't getting it because they're unaware that they qualify for it. This video is going to help you find out if you can qualify and why you should consider doing it. Look, I don't claim to be an MSP expert, but I do know a few at the Office of the Aging. And if you think you may qualify, if we think you're even close, we always suggest that you apply because the first time you apply, the application is very simple in New York State. It should also be known that assets don't matter. It doesn't matter if you have money in the bank or your own house or real estate. It's only income based. So that's important to know. And the other thing is that I'm laughing a little bit because I've helped so many people who were so unaware that they qualified for this. And then when they got it, they were so appreciative. They were so thankful because it was $2,400 a year back in their pocket. It helped reduce the cost of their drugs, especially those inhalers. I got a call the other day and the inhaler was only $15, down from probably several hundred. So for me, it's a real warm fuzzy. Okay, so here are the new income thresholds for 2026 in New York State. These vary by state, and New York is pretty generous, so many people can get this program. It's just over $40,000 a year if you're married. Again, no assets, they don't matter. And it's around $30,000 a year for a single person. Again, they have some flexibility, some leeway in here. Stay tuned, I'm gonna tell you why. So as I said, I don't claim to be an expert. However, we've had a lot of things happen beyond what I've already explained. Some people have experienced getting Medicaid with have no co-pays. And if they go to a doctor, if they go to a hospital, if they have surgery, they have no co-pays because Medicaid pays them. They become full benefit dual eligible. When you send in this application the right way, if you qualify for more, they're going to give it to you. It comes through the county Department of Social Services. That's where you send the application in. Here's what the application looks like. If you can't find it, send me an email or a text. I'll get it out to you probably as soon as possible. And look, here we are, those handsome devils, us. You can text us, you can call us, and you can email us. Aaron at MedicarePrepare.com, Travis at MedicarePrepare.com. Now, I know somebody is going to tell me again, I'm over the threshold. I never qualify for anything like this. That's the way life works for me. If you're over the threshold, there are ways that we could lower it. One of the ways is by buying a Medicare supplement. Any premiums you're paying for actual health insurance, some Part D premiums, but that's a little tricky. Those premiums can help reduce your income. So hypothetically, you have a $3,000 a year Medicare supplement. Now your income can be as high as $43,000 a year married, $33,000 a year single, and you can get the Medicare Savings Program. So it's worth a conversation. But that's really it. But I am going to tell you a success story. If you feel like listening to this, it really is a funny story. If not, you can just X out of this. I had this couple insured for a few years and I had to go down there to see them. So I went down there to see them and, he was a great guy, old school, but very strict and rigid. And I never asked him how much money he made. I asked ballpark questions because I don't care. I'm not nosy. is your income over or under this amount? Is it over or under this amount? I'm trying to gauge whether or not he may qualify for something. So I determined that he was going to qualify for this, and his wife. And he says to me, you're telling me that I'm not going to have to pay this Part B premium for me or my wife anymore, that they're going to send me back money for the last 3 months, my medication costs are going to go down, and I can afford to buy a pizza? And I said, that's exactly what I'm speculating. That's never going to happen, he says to me. I said, okay. I said, listen, let's just send it in. And if it does happen, here's what I want from you. I want you to call me. I want you to say, hey, Aaron, attaboy. So I want you to know 3 weeks later, I got a call from that guy. And he says, hey, Aaron, attaboy. And that made me feel so good because this guy was a tough guy. This was not an easy guy. But anyway, I thought you'd appreciate that story. That's why I threw it in.